Hello and welcome to the first Macular Society webinar of 2024. Who can believe it? 2024. I'm Kathy Elf and I'm the Chief Executive of the Macular Society, and it is lovely of you to join us, and thank you very much indeed for coming into our webinar room this evening. The format of this, if this is the first time you've joined us, is that we welcome our esteemed guest who will give us a talk on her specialist subject this evening. There'll be lots of time for questions at the end of her talk, and I'd be grateful if you put those questions in the chat function, and we'll get to as many of them as we possibly can at the end of our guest's talk. If you have to leave us at any point, or you find you can't watch to the end, we're recording this session and it will be on our YouTube channel, it'll be on our website, available in a day or two after this session. So don't worry if you have to disappear, you will always have an opportunity to catch up. So I want to introduce tonight's special guest. Sonali Dave was awarded a BSc Hons in Human Biology and Psychology at Kingston University, and it was there that she discovered her passion for neuroscience and vision. As a result of that, she then went on to complete an MSc in clinical neuroscience at King's College in London, where her research focused on visual hallucinations, especially in Parkinson's disease. But of course, many of us know the visual hallucinations are a common feature of people with sight loss conditions as well. And in fact, Sonali did further work on hallucinations before moving to City University of London, where she joined the Department of Optometry and Visual Science. While she has been there for the last 3 years, she has completed, or very nearly completed, a PhD entitled Patient and Practitioner Communication in AMD. Now, this piece of work has focused primarily on the lifestyle advice that patients get or do not get from their eye care provider, whether that's a doctor, a nurse, an optometrist, and so on. And it is that piece of work, this PhD study, which has been funded, in fact, by the Macular Society, by probably many of you who have generously contributed to our research funding. And it is that piece of work that Sonali has been invited here tonight to talk about. So Sonali, welcome to the Macular Society webinar. It's very good of you to give up your precious evening time for us. But we're very keen to hear about your PhD and the work that you have done on patient communication. So I'm going to hand over to Sonali straight away. I'll disappear in the background. And I'll be back at the end of Sonali's talk. So Sonali Dave, straight over to you. Thank you.
Thank you. Thank you so much, Kathy, and thank you all for joining this evening. It's such an honor to be here to present my work that I've done, and I really hope that you all enjoy this talk, and hopefully you have loads of questions for me as well. So I'll just share my screen with you all. I've prepared a few slides. Can everyone see my screen?
I think we can.
Okay.
We probably like
oh, there we go.
Oh, perfect. Thank you.
So thank you so much. Like Kathy said, my name is Sonali. I am a final year PhD student, final few months PhD student, and my research has focused on patient practitioner communication in AMD. So it's based at City University of London, but we've covered a lot of regions in England, and I'll go through some of my results with you today. So I'm not going to go into the details of what AMD is, but it is the leading cause of irreversible blindness in developed countries. And by 2040, it is predicted that we will have around 288 million cases worldwide. This sort of picture might seem very familiar to you. You might have seen these in leaflets or on websites, or if you Google AMD, this sort of image comes up. But importantly, there's been a lot of research that shows that actually this image might not necessarily be accurate. So the information that people get from this picture might not necessarily represent what someone with AMD would see. In fact, it's things like wavy lines, bending, fogginess, patchiness, blurriness, or seeing 2 lampposts instead of 1. And the reason I bring this up is because this just highlights the importance of hearing what the patients are experiencing, what patients believe is the main issue with their vision, and to understand their experiences as well. So background. So like Kathy mentioned, I'll be talking about lifestyle advice. So you may or may not have heard of different lifestyle factors that can be modified to help slow down the progression of AMD. One of the main factors, the main modifiable risk factor for slowing down the progression of AMD is smoking. And this study has actually found that smokers have a 4 times increased risk of AMD progression than non-smokers. So it's a big factor. We've also heard a lot of stuff just for general health as well as eyes, but the benefits of a healthy diet, green leafy vegetables, different colored fruits and vegetables, and the Mediterranean diet has been a huge topic of conversation as well. And some of you may have heard about this very, very famous study called the AREDS study, where they found a certain type of vitamin formulation can actually help reduce the risk of AMD progression by around 25%. So it's the largest clinical trial that's been done. So these are all very easily modifiable lifestyle factors, so things that people can change in their day-to-day life to help reduce that risk or slow down progression. But research shows that this advice might not actually be given to patients, or patients might not remember being given any advice. And these are just 2 examples of studies. There are a lot more that show that actually this advice is not necessarily being given in a consistent way. So I'm just going to share a few of the guidelines in the UK. This is quite a busy slide, but I will talk you through it. So the 2 main bodies of governing how practitioners practice in the UK are the Royal College of Ophthalmologists and the College of Optometrists. Both bodies suggest that advice on smoking cessation services should be given to all patients, and advice on nutrition and supplements should also be provided, specifically a healthy diet rich in fresh fruits, vegetables, eggs, and oily fish. The NICE guidelines are another governing body that give advice to practitioners on how to deal with a range of conditions, and they have a specific section on AMD. And they say 4 main things: that information given to patients needs to be available on an ongoing basis. So whenever people need this information, it should be given to them at all appointments. The information should be relevant to the stage of the person's condition. It should be tailored to the person's needs, and it should be delivered in a caring and sensitive fashion. Another important point is that there should be an opportunity for all patients to discuss AMD with their practitioner. So that includes the causes of AMD, stopping smoking and other lifestyle advice, and how AMD may progress and possible complications, what it can look like. And finally, and possibly one of the most important points, is that information should be provided to everyone in an accessible format to people with AMD, and they can take that away with them whenever they ask for it, so they can refer back to the information that they have been given during their appointment. So given all of this information, given all of these guidelines, and knowing what those lifestyle modifications are, I aimed in my PhD, the entire PhD, to understand what the current situation is with lifestyle modification advice. How is it being given to patients, and is it effectively being given to patients? But very importantly, I wanted to find out this information from a patient perspective. Interestingly, this sort of research hasn't been done from a patient perspective before. It's mostly been from a practitioner perspective. So that was the aim of my study. So we started by giving people who took part in the study, they got a survey. Some of you may have actually participated in the study, so it might seem quite familiar. So patients were given a survey, the first one to ask about their experiences at their previous appointments, at their most recent appointment as well, with respect to the fact, with regards to what advice they were given. Sorry, I'm getting all tongue-tied. And then 3 months later, if participants agreed, they were sent a second survey. So just to follow up on what changes they'd made to their lifestyle, and what would have helped them keep those changes if they didn't do it. And at the same time, I also gave a questionnaire to some practitioners to understand their perspective, to understand what they believe are the main barriers to effective advice provision. So, to create my questionnaires, I ran some focus groups with 6 fantastic participants who spoke to me about their experiences of receiving lifestyle advice. And they provided some really helpful information. And I'm just going to share some of those quotes with you now. I'm not going to reveal any names or anything like that. So some people were told, I wasn't told anything other than to eat sensibly, but my sensible is probably not the same as someone else's idea of sensible eating. So the advice was very generic. Also, when you get leaflets or you get written advice in a clinic, it's often in smaller print, and it just highlights that you've got an eye condition. It felt like it was something that goes out to everyone. So it's something, a general letter saying, this is what was discussed, and that's it. So nothing that is tailored specifically to the patients. It wasn't really part of the ethos to give that sort of information. It felt like it was something that would have needed to be added on top of what the practitioners are already doing. So perhaps it needs to be more ingrained in clinics, and it needs to be as a part of the process. And also, I think this one is probably one of the most important, is that there is always this idea that you're conscious of the queue of people that are waiting for their appointment as well. So you don't want to take up too much of your practitioner's time. So all of this information that I got from the focus groups, I used that to develop my questionnaires. So my questionnaires were completely informed by patients and their experiences. So I'll just share a little bit about how I done that very quickly. So using some of these comments that patients made during the focus group conversation, someone talking about how their optician was very encouraging about joining the Macular Society, research and dietary stuff. Some pros and cons around the GP. So some people saying their GP was the one who sat down and spoke to them about smoking, or my GP didn't seem to know anything about my eyes. And a lot of information about consultants. So getting advice from a consultant carries a lot of weight. So all of these comments were grouped together into a sort of theme, which was healthcare professionals. And using that theme, we created one of the questions in the questionnaire, which was, from what source did you receive the advice? And then we knew which options to put in based on the conversations that we had at the focus groups. So once we created the questionnaire, we aimed in the first survey to understand the patient experience of receiving lifestyle advice regarding AMD in primary care. So we recruited from 10 hospital sites around England. This is actually really exciting because we were only supposed to recruit from 2, but we got so much interest that we ended up including about 10 people. There would have been more, but there was a lot of paperwork and various things got in the way. But 10 hospital sites around England and 20 independent optometry practices. And all the participants were given the questionnaires within 2 weeks of their appointments. This is the sort of distribution of where we got the participants from. Majority were actually centered around England, centered around London, but we had quite a few people from Manchester, Sheffield, Birmingham, and Norwich or Great Yarmouth. In the end, we included 404 participants in the study, which way surpassed our aim, which was 386. So thank you so much. So we had 404 participants in the study, and they were recruited from a range of hospitals like Moorfields, Huddersfield, Sheffield, James Paget Hospital, Princess Alexandra, so on and so forth, and optometry practices as well. So very quickly, just to talk you through what the participants were like, how their demographic information. So we had 60% female participants. 42% of participants were between the ages of 71 and 80 or over 80. And more than half of our participants were living with a partner, carer, or friend. And the majority of our participants had a diagnosis of late AMD, late stage AMD in both eyes, and one eye intermediate stage AMD, and one eye late stage AMD. So here are the results. We asked people about their smoking status. And in our study, 62% of our participants were non-smokers, had never smoked. 28% were non-smokers, 6% were current smokers, and 4% didn't answer the question. So from the ex-smokers, we asked them the all-important question, did you stop smoking because of your eye condition? And 111 out of 115 people said that they did not stop smoking because of their eye condition. It was for various other reasons. Then we went on to ask another very important question. Do you recall being given any advice before your most recent appointment? So have you ever been given any advice throughout your diagnosis about lifestyle? 30%, almost 31% of our participants said yes, they had received some lifestyle advice. However, 60.6% said that they'd never received any lifestyle advice regarding their AMD. And 6.6% said that they couldn't remember. So then we said, fine, how about at your most recent appointment? So the one that would have taken place within 2 weeks. Did you remember getting any lifestyle advice at that appointment? 14% of our participants said yes, they had received some advice. 73.5% of our participants said that they had not received any advice. And 8% said that they couldn't remember. And this is important because if we think back to those NICE guidelines that I was talking about, this advice should be given to patients on an ongoing basis. It should be given to patients at every appointment. And that increases the chances of people acting on the advice or remembering the advice. So we asked, what advice were you given? So out of all of your appointments that you've had, what advice have you been given? The majority of people were given dietary advice. Second was vitamin and medication related advice. And third was UV protection, so sunglasses or hats to protect from UV rays. And actually the fourth most common bit of advice was around smoking. So I've shared a quote here that really summarizes the experience that participants described during the advice that they were given. So this person said they were only told to eat green vegetables, but they were not given any advice on why, how much, and how often they should be having green vegetables. So there was information, but the information was almost incomplete. There wasn't any accompanying information to go with that. So at their most recent appointment, we asked, well, did your practitioner ask you about any of your lifestyle habits, your current lifestyle habits? And actually, very reassuringly, the most common thing that was asked about was smoking, smoking status of patients, followed by alcohol consumption, then whether or not you wear sunglasses when you leave the house. We delved a little bit deeper into the dietary recommendations. So at your most recent appointment, what dietary advice were you given? The most common type of advice given was about green leafy vegetables, followed by oily fish, and then different colored fruits and vegetables. Another important lifestyle modification was around vitamin supplements. I remember I talked about the AREDS 2 study and the AREDS 2 formulation being the recommended one to be given to patients. So we asked, did you get any recommendations about a daily supplement from your clinician? 292 people said that they had not received advice about having a daily supplement. 48 people said that they had, and 16 people said they weren't sure. And out of the 48 people that said, yes, I have received some information about a dietary supplement, half of them were told about the AREDS 2 formulation and were given recommendations of the AREDS 2 formulation of vitamins. The other half were given non-AREDS or sort of general multivitamin advice. We also collected some information on whether or not people had any more comments to make about their appointment experience. People have requested some emotional help and advice. It's a lot to take in. It's a lot to process. So having that emotional help and advice was really appreciated. Some very horrible experiences, like when I mentioned it to my GP, he asked if I was tired of living. So this just shows a lack of awareness amongst some healthcare practitioners. The GP training on optometry is very limited. So this is, probably understandable in terms of what the GP was trying to say. This was a positive experience where people said, well, it was a shock, but everyone was so kind and talked me through it, which I thought was really nice and reassuring. People were told that I'm losing my sight and that there's no cure. In other words, just get on with it, which is a terrible thing to hear. It feels like I'm only a number and not a person. And this is probably quite common in hospitals. And I think this came from a person who was given this questionnaire in a hospital. But feeling like you're part of this sort of factory of patients that are coming in and out. So not feeling like there's a personable approach at all. And also, written information was given, but it was in very technical terms, using very technical medical jargon, which just puts you off, really. You're not going to read that because it just doesn't make any sense. I've received so many letters like that I've ignored. So it's not a good way to receive information. So in the beginning, I was also talking about how the NICE guidelines say that patients should be given written information to take away at their appointments. Unfortunately, only 9% of our participants were given written information. 89% said that they had not received any written information. And this is important because we asked patients what their preferred method of receiving advice was, and it's actually the second most preferred way of receiving advice, and it was selected by over half of our participants. So I'm just going to share very quickly the results from survey 2. So this is the one that was given to patients 3 months after they completed the first survey. We had 153 participants in this study. Majority were female, 57.5%, and majority of the participants were between the ages of 71 and 80 and lived with a partner, carer, or friend. So in the first survey, we asked people what lifestyle, were you given any lifestyle advice during your appointment? And from these 153 people, 25 people said that they had received lifestyle advice and 112 people said that they hadn't. Out of the 25 people that said that they had received some lifestyle advice, 9 participants made changes to their lifestyle. And out of the 112 people that said that they hadn't received lifestyle advice, 17 participants made lifestyle changes. So in total, 26 out of 153 people made changes to their lifestyle following their previous appointment. So we asked why. Why did people not make changes? The most common reason was that, well, to be expected, they weren't given any advice. And the second most common was, I was already doing everything I was asked to. So this is a really interesting one. So even though participants believe that they were following all that advice that they should be getting, it still doesn't mean that practitioners shouldn't be telling patients about it anyway, because there might be some information there that's missing, or there might be some extra changes that people could make to their lifestyle, or they could use some extra support in making those changes. We also asked the question, well, can you think of anything that would have made it easier for you to make lifestyle changes? And the most selected option here was having more detailed information. So having information that actually outlines specific things that people need to do. The second most selected was having some written advice. The third was signposting to other services. So for example, a low vision clinic, an occupational therapist, someone who can help with other aspects of an AMD diagnosis. and 13 people said other. So someone said, well, actually, it would be good if we could get the vitamins and supplements over a certain age as part of the NHS prevention programs. Or people would like more detailed information on diet specifically, not necessarily the rest of the advice. And signposting to mental support and social support was very important as well. And we also asked, well, would anything motivate you to keep the changes that you made? And the most selected option, which I don't think is that surprising, is knowing that it's actually making a difference. So that was very important. If people felt like what they were doing is actually making a difference to their vision, then they would continue to do it. And also having regular chats with a practitioner would also help keep them motivated to keep those changes. So I'll just quickly go through my conclusions. So even though patients are being asked about lifestyle factors during their appointments, the advice about them is still not being given consistently, despite what the guidelines recommend. More than half of the patients in this study preferred to receive written advice, but most patients were not actually given that written information. And throughout the study, patients have highlighted the need for more detailed information. So the main conclusion here is that the findings of this study back up the research that's been done in the past that shows that advice is still not being given consistently, and patients' preferences really do need to be considered. We need to listen to the patient voice, and that's what I advocate for all the time. So just to go through some of the next steps, I'm going to analyze the practitioner questionnaire data. So that's still ongoing. I couldn't share that with you today because I'm still waiting on a few bits and pieces. So we want to hear what the practitioners felt were the barriers. Then I'm going to look at some of the factors that impact lifestyle advice. So, for example, is someone who is older, less likely to make lifestyle changes, etc. A very exciting development is that we are doing this survey in Australia as well. And why Australia? Because they have some of the most detailed guidelines on AMD, and they are very keen on doing the survey. So yeah, we're starting to launch that hopefully in the next few weeks. I'm also going to produce a summary of the study results. So I want to produce a summary document for the participants that took part in the study, and also for these governing bodies to show them what patients have said and what they've expressed, and to maybe hopefully make a change in some of the guidelines. And finally, I'm going to submit my final PhD thesis. A huge thank you to these wonderful people, my supervisors and mentors, and a huge thank you to our participants. So everyone who has participated in this study has been absolutely fantastic and has helped so much. And also a very, very big thank you to the Macular Society for being so supportive, not only just funding me, but also helping me find participants for this study as well. And please do, send me an email or, oh, that should be X now, it's not Twitter anymore. But yeah, please do send me a message if you have any questions. But I'd be happy to take any questions now. Thank you.
Sonali, thank you very much indeed. That was such an interesting talk. Thank you very much. Now, I mean, clearly we have, as part of our research program, we have supported this work, and we have a very good reason for doing so. And basically, I suppose I am thrilled in one sense that that you've got these findings, and it's really helpful and robust, good quality evidence. The other side of the coin is that it is exasperating. It is exasperating that we've this is still the case, and we have known for many years. Our helpline takes calls daily, multiple times a day, probably, from people who are finding us and finding out about their condition for the first time, sometimes having been diagnosed many years earlier. So it is incredibly important to have this high quality evidence and information. Tell me, what was your response to it? Is this what you were expecting to see? Were you did it surprise you, or what was your own response to it?
Well, it's very unfortunate that I was expecting it based on what I'd read in the past, but I was very upset after seeing these results, because it really, especially because I spent a lot of time with people, and I spent like my grandmother has AMD as well, and just thinking about the slowing of AMD being a possibility, and that information is such a easy thing to just mention during a conversation or just to signpost someone. It's such an easy thing to do, and it's not being done. And I think that was very upsetting for me, but it really did highlight the need for this research. So having something from a patient perspective was so important. Some of these quotes that they gave were so powerful for me, just understanding being in that situation is so stressful. And yeah, so unfortunately it wasn't surprising to me, but it really was upsetting.
Your grandmother, did she give you any clues and hints as to how to do this? What was her experience? Can I ask you that?
Yeah, so my grandmother doesn't speak much English, and when she came to the UK, but the information that was given to her was very, very vague, just sort of around oh, you can't really do anything at the moment. We can't do anything. It's just not going to happen. So she didn't do anything, and I think that was so frustrating for me. I didn't even know about this until I was in university and I'd read about AMD. That's when I found out actually there was things that my grandma could have done 30 years ago that would have made a big difference to her, and she would have had longer with her sight to be able to see more. So it's really upsetting for me, but it's motivating for me to do this research. It's motivation for me to keep fighting, and to keep publishing this research and taking it to people, hopefully to see what they have to say as well, like especially the governing bodies and practitioners. It will be quite interesting once I've analysed the practitioner findings as well.
It will be. Please put your questions in the chat if you wouldn't mind. I can see a few people have got their hands up. I'm going to have to consult Felicity to ask her whether we can actually hear people if we go to people who've raised their hands. It's better if you put it in the chat. Hang on, I think we possibly can. I think we have Dilys on the screen. Dilys, do you want to ask your question? You need to turn your microphone on.
Can you hear me now?
I can, yes.
Yeah. The reason I wasn't using chat was because it had been disabled.
Oh dear. Oh
yes.
Dear.
I don't know whether everybody else was in the same position, but anyway. Yeah, during these, I mean, thank you, a really useful session. But there were a couple of things that were mentioned, and I didn't understand them. One was something about AREDS2, and the other one was RH2, and I think they might both have been about vitamins and supplements, and this is all new to me.
Okay.
Sonali, can you give us a quick snapshot of the AREDS 1, AREDS, AREDS 1, and AREDS 2? There were two associated studies, weren't there?
Yes. So AREDS 1 and AREDS 2 are two studies, the largest clinical trials that have been done on vitamin supplements for AMD. And they are a specific formulation of vitamins. So they include things like lutein, zeaxanthin, calcium, zinc. It's a specific formulation that's been made to give to people with AMD, and it's shown to reduce the risk of AMD progression or slow down AMD progression by 25%. So the AREDS2 supplement is the one that is recommended, and that practitioners should be recommending to patients as well.
Well, nobody's ever mentioned this to me, and in fact, I googled things and found out about the Lucian and the other one with the unpronounceable name.
Yes.
I don't know. Is there something that you can recommend or give an idea because I don't even know where to go and buy these things.
So I can't prescribe anything, and they're
Oh,
not on prescription, but
oh, are they?
then yeah, you can buy them online. I know a few people have bought them on Amazon, so they are available. Or you can speak to your practitioner and say, can you tell me where I can get these over the counter? And I know that places like Boots also have them.
Okay.
So they would be a
Yes,
good
so
option.
they're usually available. I think what happened was that in the AREDS 1 study, they're quite old, these studies. They're more than 20
Yeah.
years old.
Okay.
And the first one used something called beta carotene, which is known to cause raise the risk of lung cancer in people who have ever or currently do smoke. So the second formulation of AREDS took out the beta carotene, but by then people were becoming interested in lutein, so it added in lutein, which was not in the first formula. So AREDS 2 is regarded as the most up-to-date one. But it is not everybody thinks that it's entirely valuable. But people, you can buy it. Once upon a time, a few practitioners would prescribe it on the NHS, but they don't any longer, and it's not part of the NICE recommendation. But many people do think it's valuable, and there is some evidence for it. It's the best evidence that supports supplements, and so you can buy it over the counter. In most pharmacies will have an AREDS 2 supplement formulation that you can buy.
Thank you very much.
That's
Okay, we have Liz. I think Felicity, can we bring Liz to the fore because she's got her hand up too? And there are some questions coming in, so that's great. We'll come back to those questions in a second. So Liz, do you want to tell us what your question is, please?
Hello, can you hear me?
Yes.
Thank you. That was a really interesting talk, and a very interesting study, and really needed, I think. I was given no information at all when I was diagnosed, and I think I have two questions. Well, no, maybe three, if that's possible. The first one is, do you have any idea about what ideally people should be saying, practitioners should be saying about the possible progression of the condition? Are there guidelines for what they should be saying?
Yes. So the guidelines do say that practitioners should be giving this information in first of all, in a very sensitive way. They should be opening the floor up for discussion and opportunities to ask questions for people, especially people who are recently diagnosed. They should be getting an opportunity to ask questions. But also regarding information about progression, they should be giving them very clear information about smoking cessation, and signposting them to stop smoking services that can help. With regards to dietary information, they should be telling people about the benefits of eating green leafy vegetables, different coloured fruits and veg, and signposting them again to some dietary guidelines, leaflets, nutritional information. And they should also be informing people about the AREDS supplement. So all of this information should be being covered during appointments. Unfortunately, it isn't always covered.
Do you know if a sort of parallel study has ever been done asking practitioners about their experience and whether they know the information they should be giving and what it is that stops them?
Yes, and that is a very good question. We have had a lot of studies actually that talk to practitioners and ask them where they get their information from and what information they're giving to patients. Unfortunately, it's shown similar trends along the lines of 17%, I think it was around 17% of people were giving smoking advice to patients, so advice to stop smoking. So that was such a small percentage of people that should be recommending such a large modifiable risk factor for AMD. But also in my study, I've asked patients as well, I've asked practitioners as well about what they're recommending and what their experiences have been with recommending this information. So I will I'll hopefully keep you all updated on that as well.
Okay, thank you
That's
very
great.
much.
Very much
Thank
indeed.
you.
That's a good question. Derek has got his hand raised as well. I don't know if we can bring Derek up to ask his question. Good evening. You have to activate your microphone, Derek, if you could, please.
To say that the AREDS 2 recommendations are for instance, Macular Gold.
Yes.
I did buy some Macular Gold, but when I looked on the warnings on the side, it said if you are taking blood thinners, it might not be for you. I spoke with my doctor and he said, no, it is not for you. Don't take it.
That's a very good point, Derek. And I think Sonali would, I'm sure, agree with this, that before anybody takes any supplements, if you're on other medication, it's always sensible to check with your GP, isn't it, to make sure that you're not going to conflict in some way. You know, even herbal or traditional medicines can interact, can't they, with other medicines that you may be taking. So thank you for making that point, Derek. That's really very important indeed.
Yeah.
There's a question about literature, where people can find literature about this. I'm going to say this, lots of ours is definitely the best. So phone our advice line, our helpline, and they will send you literature, but it's also all on our website. So you can download that information. If you wanted to know more about the AREDS trial itself, then there's plenty of information online about that. But do give our helpline a ring and they will be able to signpost you and send you to the best kind of information that we've got. Other information is available from other organisations, of course. I'm sure RNIB have got lots of good information about diet and supplements as well. But give our helpline a ring, and the number is in the chat, and I'll give it out in a minute or two. A very interesting question here is about when in taking supplements. What is the evidence, Sonali, about when is the best time to take this? So you mentioned this 25% reduction, but it's a bit patchy. It depends on where you are in the process, isn't it? So it doesn't say, it doesn't help very late stage AMD as much as it helps the intermediate. And I don't think anybody has done any studies on the very early stage AMD, although common sense kind of suggests that the earlier you act on your diet and giving up smoking, the better it's going to be for your eyes.
Yes.
But the evidence is a bit patchy, isn't it? It's a bit difficult to tell.
Yes, absolutely. I think the AREDS group have done a lot of research, but unfortunately it is limited on late AMD and early AMD. But I think people that are at the stage of just finding out that they have AMD, once you've had a chat with your practitioner, with your consultant, or even with your GP, if you're recommended the AREDS supplement, I would suggest to look into it, to consider it as an option, because yes, the evidence is much more prominent for intermediate stages of AMD. But yeah, the earlier the better. The earlier you can start making those changes to your lifestyle, just start implementing those green leafy vegetables early as possible. If you have family and friends that are younger, just recommend it to them anyway. You know, it doesn't hurt to eat some green leafy vegetables, of course. But yeah, so I would suggest probably looking, I think there needs to be more research about it. But yeah, early or intermediate AMD is probably the best time.
Well, it was interesting when NICE developed their guideline where they, and I sat on the guideline development panel actually arguing for some advice on dietary supplements, but they didn't feel the evidence was strong enough to make a recommendation that they should be provided on the NHS, but they did make a recommendation that there should be more research into this. The problem is it's been very difficult to get. These are very expensive studies, aren't they? These long-term studies looking at lifestyle, the impact of lifestyle on disease progression. And nobody has been willing to fund these multi-million pound studies. We still have good quality evidence. Several people have raised experiences of you had this specific finding that advice from a consultant carries a great deal of weight. People really value that advice, and yet people are saying again and again they hardly ever see a consultant. They see a consultant a year, they consider it a bonus. Of course, the sad truth is that we haven't got enough to go around, have we? No.
Yeah, and that's such an unfortunate thing. We hear all the time about these huge waiting lines in ophthalmology, and yeah, the consultant's time is very limited, but it is an important conversation to have with the consultant. But I also believe that other eye care practitioners should be trained in giving this information as well. So people like optometrists, nurses, healthcare assistants, even technicians should be given this information. They should be able to at least give out a leaflet or some written information for people to take away. And also, yeah, I mean, I have said it before, but the Macular Society, you guys have some excellent resources that really highlight and break down the key information. So, you know, just accessing these resources. I didn't include it here, but we did actually do another question about what services patients were referred to. Unfortunately, the majority of people were not referred to any charity services, but the ones that were, I think it was about 90 people out of 153 were told about the Macular Society. So still not a huge number, but it is better.
Good. Well, that's encouraging. Another question, and I suspect this has come from a healthcare professional. I don't know. Do you have any views on a formal or structured health promotion model? Because one of the things that is very interesting is, I mean, we know that healthcare professionals are incredibly pressed for time. There aren't enough to go around in the first place, and you know, this bish bash bosh get people through the clinic means that they feel that they don't have time. A lot of the time to stop and have these conversations, and we know that that's going to be a genuine thing. But there are other barriers as well, and a health promotion model, this questioner has suggested, may work better than an unstructured way of passing on information. Do you have any views on that, or any experience of that? Perhaps
Absolutely.
when you analyse your professional feedback data, you might have some ideas, but any clues on that yet?
Absolutely. I think that having some kind of structured health promotion would be a great way of getting information to patients. And it would be something that could be, if it's something that can be accessed at any time, I think that's just going to be even better. But that was something that came up. Again, I very briefly looked at the practitioner findings, and a lot of the comments were, we do need a bit more structure on how to give people this information, or some structure on how to signpost people to services that can help. So, you know, there have been very new studies on having some kind of designated person in a clinic to provide this lifestyle information, or having someone who calls you after your appointment to talk about lifestyle interventions. So there have been studies that shown how effective that is. So yeah, I think it would be a fantastic idea if we could get professionals in a room to brainstorm some ideas on what we can do, how we can give this information in a structured way. Yeah, I'm 100% all for it.
Could that be a follow-up piece? Somebody else has asked, is it going to be follow-up? But perhaps you've just identified what the follow-up might needs to be. We need to understand what is preventing this communication from happening. And I'm not, I don't know about you, I don't know about our audience tonight. I'm not particularly satisfied with the answer is, I haven't got time. And that doesn't seem good enough to me. I don't know, really, doesn't seem good enough. Another question here is it ever too late to take supplements? Do we know the answer to that?
We don't unfortunately know the answer to that. But if you are recommended supplements, and if you are, so for example, if you have late stage AMD in one eye, or intermediate AMD in the other eye, the evidence suggests that it wouldn't be too late to start taking the supplement then. But again, please do speak to your practitioner before you take anything, before you start to, you know, take any sort of supplement, any sort of herbal remedies as well. Please do speak to your practitioner first. But I think if it's recommended to you, and if your practitioner says it's safe to go ahead, I don't think it would be too late if you're at that point.
Yeah, I mean, I suppose at the point where people have lost all their central vision, in terms of supplements, that would probably say, well, it can't restore vision. We know that. You know that
Yeah.
it can give people vision back. So at
Yes.
that point, I guess we would say it was too late. But there are lots of other reasons for general health. It turns out that what's good for your heart and
Yes.
and your brain is also good for your eyes. And so there are lots of other reasons for continuing to eat healthily, eat those green leafy vegetables. And you made that great point about, you know, if you've got children or grandchildren, get the leafy greens down now.
Yes.
You know, young before any damage is being done. Okay, that's really good. Now we've still got a couple of people here. Derek, if you'd like to put your microphone on and ask us your question.
I did actually go onto the NHS site and asked about vitamin E and blood thinners, because most people who have AMD seem to be older people, and they are probably on blood thinners. So I think it is very important to get it checked with a doctor. My doctor told me, no, don't take it because the blood thinners will be affected, and it's not a good idea.
Yeah.
Yep. Thank you very much for making that point. I think it is the vitamin E in the
Is in the AREDS too. Yeah.
I think that's the thing that they're concerned about. Derek, thank you very much indeed for raising that.
You're welcome.
One other person, one other raised hand. This is Malcolm. Hello, Malcolm.
Hello, can you hear me?
Yes.
Good. And I'm interested in the diet situation. Having lived nearly 20 years in the south of France, I'm fairly used to a Mediterranean diet. Is there any investigations if in Mediterranean countries, if AMD is less prevalent?
That is a very interesting point. Not that I'm aware of. The research has been done on people, the research that has been done is on people that follow a either a Western, like a UK based or a American diet, and then they changed them to a Mediterranean diet, and that has seemed to help with AMD progression. So there actually isn't any research that I'm aware of that's been done on people in Mediterranean countries, but I think that would be really interesting. There is research on people in who follow a Mediterranean diet in Mediterranean countries, where they have had other health benefits, like reduced risk of diabetes. So that it would be really interesting to do that research on AMD as well. I'd love to do it. I'd love to do all the research. But yeah,
everybody's always talks about Mediterranean diets and how good they are for you for all sorts of things.
Yes.
And the Mediterranean is a fairly big ocean, and there's lots of countries using a Mediterranean diet, and it just, you know, I just thought it would short circuit any investigation into dietary problems, you know, or successes.
Yeah.
Anyway,
absolutely.
thank you very much.
Thank you.
Thank you, Marco. It's a very good point. I think there is a little bit of evidence about it. There's also some evidence, isn't there, I think, around when people switch to very high processed diets, that does increase the risk.
Yes.
I think quite a lot. So and of course, as we say, the Mediterranean diet is good for all kinds of other things as well. There's a question here about amlodipine. Is it a blood thinner? I don't think it is. I think it's a blood pressure
medication. Yes.
Not a blood thinner, but we're not doctors. Please don't take our word for that. But do go and double check. I think we have one other. We're running out of time, but let's try and get Joan up. Joan, what's your question?
Okay, yeah. What I wonder, I've had Crohn's. I'm 70, nearly 80. I've had Crohn's disease since I was 20. Have Crohn, CHRO, Crohn's disease, which is to do with your bowel. So you don't take. I had an operation when I was 20, so I don't take in lots of vitamins. So for say 10, 15 years, I was told don't take any root vegetables, eggs, any dietary dairy stuff was out. So I've always really at the back of my mind thought that because I can't take these things, it had something to do with a poor diet, with me having macular degeneration and glaucoma. Did you do any research with people who'd got Crohn's? There's Crohn's and colitis. I don't know if you...
Yes, yeah, I had a few people in this study that said that they had Crohn's, and they did say that, well, they were restricted on what dietary changes they could make. And I think one of the main things that came out of, so we did ask people what other, sorry, I had so much information in this that I couldn't include it all, but we did ask people, do you have any other health conditions, and do you feel like your health conditions were acknowledged by your practitioner? Unfortunately, a lot of people said no, they felt like their health condition wasn't acknowledged. So even someone with Crohn's was given advice to eat foods that would possibly be harmful for them. So the main takeaway from that was information regarding dietary change should be tailored to a participant, or for someone with Crohn's or any sort of bowel issue should be referred to a nutritionist to give proper tailored advice. So yeah, it's just about practitioners listening to the patients and what their individual situation is. So yeah, we had people with Crohn's, and unfortunately they did have that situation of, am I missing out on something because I can't eat certain foods? But that isn't the case. If you speak to a nutritionist, they'll be able to advise you on the sort of foods that you can eat that would be helpful.
Yeah,
By the time I was 40, I was told, eat anything that you want, and if it doesn't agree with you, give it a rest for a time. So I've done that since. Can I say that when I first started with Macular, I read in the Daily Mail about vitamin tablets, and I've taken vitamin tablets. I don't know whether they've done me any good, but I've taken them, 30 years now.
Well,
Yeah.
fingers crossed they have, Joan. Thank you very much indeed for your question. That's
Thank
really great. We're running out of time. There's just one question here. I want to just somebody who's been recently diagnosed with very early AMD and told that they don't need to see an ophthalmic consultant. Does this seem correct? Well, sadly, the clinics are full of people who can be treated. A very early AMD, sadly, we don't have a treatment for that at the moment. So I guess that is why you've been given that advice. But you do need to stay in touch with your optometrist and make sure that you get monitored really regularly. Go make sure you go at least every year, and make sure that you get seen regularly. Sonali, would you want anything to add to that?
100%, I agree. Yeah, make sure you're seen by your optometrist regularly. Make sure you're keeping up to date with information that's on the Macular Society website, on the RNIB website, or various other places where you can get that information. But speaking to your GP might also be helpful. Even putting something like AMD on their radar, if they weren't aware of it before, it might prompt them to do a little bit of research on it, which can only help everyone. So yeah, please do speak to your optometrist, keep in touch with them as much as possible, and yeah, please do refer to the Macular Society helpline, because I've heard very good things.
You've got to monitor your vision to make sure that you pick up any changes
Absolutely.
really quickly, and the our helpline can tell you how to do that.
Yes.
I sense so much, a bit of frustration, people recognizing, Sonali, what you've been saying about their experiences. It's come through so clearly on the chat today, and so let's hope we can do this follow-up advice. We need to go to the college and the Royal College and say, come on, we need to work together to see how we can make this better. So thank you very much for the research that you've done, Sonali, and presenting it to us tonight. It's been really interesting and great to have that piece of very valuable evidence. Thank you, everybody, for joining us tonight. It's been great to have so many people on the call. Absolutely fantastic. Helpline number 0300 30 30 111. 0300 30 30 111. It's all on the website. You can find it there. Look for us on social media. Facebook is a great place to learn from other people's experiences and to share your own and be part of that great community if you're a Facebook user. If you're not, give it a go. We've recorded, as I mentioned, earlier this session tonight, and it'll be available via our website in a day or two. And we will, of course, be back next month, Tuesday, the 20th of February at 7 o'clock with another exciting and illuminating speaker. Sonali, once again, thank you very much indeed, and congratulations on
thank you so much.
Research done. We'll revisit it when you've published your findings in full. Thank you very much indeed, everybody.
Thank you.
Have a very good evening. See you next time. In the meantime,
Thank you. Bye.
goodbye.
Thank you so much. Bye.
Goodbye.